Hello everyone, I'm Dr. Shireen Furtado, Senior Dermatologist at Aster CMI Hospital. The topic for today is skin cancers, and this is a growing topic of interest, and it is one of those cancers which are easily preventable if we detect it early. This coming May, we call it the Skin Cancer Awareness Month, and here are a few tips to identify and to prevent skin cancers early. When we speak about skin cancers, we have two types. We have the melanoma type and we have the non-melanoma type. So when we talk about the non-melanoma type, there is the basal cell carcinoma and the squamous cell carcinoma. So the basal cell carcinoma is easy to detect. It comes in areas which are sun exposed, and these areas look a little pearly and nodular, and they can be picked up, and whenever you have a doubt, please visit your dermatologist to get a proper diagnosis and treatment. Now coming to the melanoma types. The melanoma types are a little bit more serious because they sometimes end with fatality, and these are the ones which I will be teaching you today how to pick up early so that you can prevent it yourself. Now, we all depend on the dermatologist for the diagnosis of melanomas, but the best person to actually diagnose and find out something wrong is you yourself. So you have to be aware of the multiple lesions which are there on your body, and if you're a type of person who's got a large number of moles, please keep checking your skin frequently, maybe monthly once, in a full length mirror. If you can check the distribution of your moles, then you will be able to pick up the moles which are a little irregular in size and which look slightly off and which you feel could need more investigation and diagnosis. The mnemonic ABCDE is how we pick up a melanoma. So A is for asymmetry. So if you see a mole which has been symmetrical and then suddenly starts getting larger or moving away from the midline, then we can try suspect maybe there is this mole which is looking a little off, which you've been watching it for a few months and you feel that this is not looking okay. We can get that checked. B is the border. Normally the border of a mole should be very flat. So if you see that the border is looking a little elevated and a little raised, it's not all right, so that needs checking. ABC, and then the D is a diameter. So diameter it's very a very broad term. So normally we say something bigger than a pea size, but not all moles are dangerous. Big moles are dangerous. Only if they start spreading rapidly, that's when we have to worry. E is the evolution. Now this evolution is the most important one. So evolution normally means that this mole has evolved as a flat surface and now it is spreading, and you can see that there are some tongues approaching on the other side. So this evolving moles are generally dangerous and they need to be. I skipped C. C is for color. So if the color of the mole is looking slightly off, if it is looking like a bruise or if it's looking a little reddish or bluish, it needs checking. Right, so this is about the ABCDE of a mole, and evolution being the most important, because if you feel that you've been watching a mole and it is evolving into something different, please visit your dermatologist and get a small procedure like a skin biopsy done to check if you're on the right path.